Hey y'all, welcome to the Convos with Anita Santiago podcast. I am your host, Anita Santiago. Please like, share, subscribe, and follow the podcast on all the major platforms and social media pages. If you'd like to get in touch with me about the podcast, you can contact me at convoscws at gmail.com. So I want to start off this month of May with mental health awareness. Now, the first few months of the podcast for 2025 were devoted to uh, topics to help us all elevate and grow a little bit more. And I'm going to pivot a little bit since it's Mental Health Awareness Month to talk about some mental health topics that are important, I feel. So, the title of this episode is Mental Health Awareness. And we're just going to start off with careers in mental health. I think the need is so great. I could be on this podcast screaming, we need providers until I'm blue in the face, and we could get a lot of providers and we would still need more. There are many different fields within the mental health arena. No, no title or no degree has a lock on mental health services. And I just kind of want to talk about that because I talk to people often and they'll say, hey, I was kind of thinking about doing something in mental health or counseling, but I don't know. It seems very hard, or I don't know which route is the best route to go. Should I get a bachelor? Should I get a master's? Should I get a doctorate? What should I do? So, this part of the podcast episode today is geared towards people who may be considering a shift into mental health services. So, I, if you follow the podcast, you know that I did a career change. I was administrative professional and decided to go into mental health. And it's been quite a journey, and I've enjoyed it. I enjoy working with people. I enjoy serving. So, I want to take a moment and talk about the different mental health occupations, what they do and what they don't do, and what the needs are. I think in a country like the United States, where we have so many cultures and so many different um, people with different backgrounds and experiences, it really is important that people are able to get services that are culturally competent. That's a big need as well. The United States is a huge country. I mean, just geographically, it's huge. And we just have a tremendous need for providers from all backgrounds and languages. So let me just start off with I'm going to start at the top and work my way across, not down, because we're all equally important. So let's start with psychiatrists. Psychiatrists are medical doctors that prescribe and manage medications for those that have mental health symptoms that respond well to medication. Not everyone does respond well to medication, but there's been a lot of research and there are a lot of well known medications that are out there. Psychiatrists see their clients, and they typically, those visits typically center around medication management. So that is a MD degree. So you would bachelor's degree, and then you go to school for your MD, and then you do a psychiatric residency. There is a tremendous need, not only for psychiatrists, but for children's psychiatrists. In many parts of the country, this is one of the huge shortages, and it's been hard to get providers because the medical schools only turn out so many physicians a year, and not everyone wants to go into psychiatry or child psychiatry. But that is an option if you're thinking about mental health, because why are psychiatrists important? They're important because finding the right mix of medications or finding the right medication that helps a person it's something that's requires a lot of analysis and understanding your patients and a passion to serve. And often in mental health, you will find that the people who need the services are the ones who can least afford it in a lot of cases, not all cases. So psychiatrists are really instrumental in areas where there's a lack of providers, either urban or rural, or where there's a tremendous shortage. So psychiatry is definitely an important part of the mental health landscape. We also have psychiatric nurse practitioners. They have really stepped up to the plate, in my opinion, to provide services where physicians are not available or able to meet the need. And you have tremendous, amazing psychiatric nurse practitioners, and we're seeing more of those. And they too also do medication management. They don't do therapy. A lot of times they don't do psychological testing. A lot of times some do, but I'm just speaking in big generalizations here about the different occupations. But that's what nurse psychiatric nurse practitioners do. So that's an advanced nursing degree. So most nurses have either a 2 year or 4 year degree. And then to become a nurse practitioner, there's advanced training and advanced degrees and certifications that one would have to get to step into that role. There's a huge need because, like I said, the psychiatric nurse practitioners are stepping into roles and areas where there's a lack of psychiatrists. So that could be an option if you're thinking about a career in mental health services. Next, we have psychologists, and that's where I kind of am now, but that's not where I started. You have psychologists that are researchers, mostly in the academic environment, and or teachers in the academic environment. And then you have practitioners that mostly work with clients. There are two predominant degrees for psychologists, the PhD and the PsyD. The PhD is kind of geared towards those that are going to work in research in the academic world. And the PsyD degree is geared towards those who see themselves as more practitioners than researchers. The degrees don't really have a lot of distinction. They're just the programs are outlined a little different. So the PhD programs are going to be a little bit more rigorous in the area of research, but don't make a mistake, because the PsyD programs are also rigorous in research, but the focus is more on clinical work versus teaching. So psychologists are very important. They can fulfill several roles. Psychologists do psychological assessment, which is a comprehensive type of psychological evaluation to help clients understand what they may be dealing with as far as their symptoms. Psychologists are also therapists. Many psychologists do both. There's a tremendous need in cities and rural areas, in schools, for psychologists. People just are typically not going into that field. I read an article a couple of months ago that said, I think it was, I hope I have this right because I didn't write it down, but in Texas there's like one school psychologist for every 12 children, which was uh, highlighting the tremendous shortage within Texas for school psychologists. But within psychology, there are a bunch of different areas in psychology. So there's clinical psych, there is neuropsychology, and several other school psychology. There are several um, areas in psychology that people can emphasize or specialize in. School psychology is really unique in the sense that those psychologists work in the school environments and their population are school children. So they're dedicated to providing assessment services primarily in the school systems. Now, we know that our public school systems are really suffering in some parts of the country due to lack of funding, lack of staff. Teachers are leaving the profession. There's a lot going on in education. School psychologists are really critical because they're that bridge between the clinical world and the education environment. They can help educators understand what kiddos are experiencing as far as mental health symptoms or behaviors. And so having competent school psychologists is really, really important. And there's a great need. Child psychologists, there's a great need. There is a need for providers who work with children, especially children under 10. That is a that's challenging work, and it's not everyone's comfort zone. So school psychologists and child psychologists, really, really high need for those. So we have psychiatrists, psychiatric nurse practitioners, psychologists. Let's talk about social workers. Social workers are amazing. Have a social worker in my family. I know lots of great social workers. Social workers have a great role in that they have a multi-tiered approach to their clinical work. So social workers plug people into services more or less, but they also can get additional training to do clinical work like therapy, coaching, and other things like that. And just like psychologists, social workers can specialize in different areas. You can work with a certain population, or there might be a certain experience that you want to build your clinical work around, such as parenting or special needs children or um, addictions. So social workers are very important. The social work degree is a 60-hour master's degree for clinical work and licensing exams that are required by state. And just like the psychiatrists, the nurse practitioners, and the psychologists, there are uh, academic standards for accredited programs that ensure that everyone who goes to an accredited program has the training that they need and the skills that they need to do the type of work that they want. So social workers, LCSWs, are the ones that typically do clinical work and including therapy, and in some cases, some assessment. So all of the professions have the ability to do some kind of evaluation or screening of their client's symptoms, and what is allowed varies by state, and it also varies based on the particular item that you're using or the particular screener or testing tool. Some are restricted by the publishers to certain levels, but for the most part, social workers, psychologists, psychiatric nurse practitioners, and psychiatrists, all have the ability to make those evaluations because it's important to understanding what the client is experiencing, and it's important to help them get to an answer. After social workers, we have licensed professional counselors. That's where I started. That's usually a 60-hour master's degree that's focused solely on therapy. Um, Again, there's an accrediting body for those programs, and if you go to an accredited program, you'll be assured that you have the education and skills that you need to sit for your licensing exams. And yes, the requirements for counselors can vary state to state, just like the other professions. But when you're a licensed professional counselor, all you do typically is therapy. And just like the other professions, you can go into a bunch of different areas, addictions, um, grief, um, severe mental illness, and those types of things. So there are a lot of different opportunities. Again, the need for people that specialize working with children under 10 is humongous. I can't keep saying that enough. There are also very unique types of therapy, such as play therapy. And as a counselor, and play therapy can be used with children or adults, is primarily used with children, but that's a specialty type of skill set that you can develop that's geared to really helping small kiddos that don't have the language or the words to describe what's going on in their lives, to help them um, be able to communicate to you what they're struggling with. So that's really, really cool. So, licensed professional counselor. Then, outside of all of those professions, there are other very specialized approaches that are really unique but have a purpose within the mental health service landscape. So, you have music therapists. That is a very specialized degree. And again, they have, their degree programs all across the country. But this intervention focuses on using music as a therapeutic tool and intervention. And so that is also a master's degree and requires training and supervised hours, just as the other professions do. But when people think about mental health careers, I don't know that music therapy comes up as something for them. And closely connected to music therapy is art therapy. Again, another master's degree, specialized training, using art as an intervention to help people process or work through their mental health symptoms. It's very, very, very specialized. And the people that do art therapy and music therapy are also critical to this mental health landscape. And so you have all of these professions, and depending on the environment, you see these professionals working together. So in inpatient environments, hospitals, residential treatment centers, you will see psychiatrists, psychologists, nurse practitioners, um, music therapists, art therapists, perhaps working together to service clients. When you get into outpatient clinics, you may see nurse practitioners and psychiatrists working together. If it's a private practice, you may see social workers and counselors working together. So, you know, in the world of integrated services, these people in these careers tend to work together, in my opinion, more than they work separately. So if you're a person that's been kind of on the fence, thinking about going into mental health, do your homework. See what program and what approach will resonate for you, what works for you. I started in a clinical mental health counseling program, and I went on to a clinical psychology um, doctorate program because I knew I wanted to do assessment, and that was very interesting to me. And I knew I was going to need the additional credentials to do that. It's very important that you do your homework on these programs. Make sure that you're understanding if it's accredited, understanding what the requirements are, understanding what the ask is going to be. Some programs, like counseling and social work, have online options, meaning that there are accredited programs that people can enroll in online and still qualify for licensure, whereas psychology doesn't have any, I don't think, um, truly online programs that would qualify you to be a licensed psychologists. There are many doctorate level programs for psychology, but the accredited programs, they have a couple of hybrid that incorporate online and residency, but there's no true online accredited program for psychology. If you're considering a career in mental health, do some research, think about what it is you want to do, and do it. Like the Nike commercial says, I think there's a misconception that mental health work is telling people what to do. It's not. It's not sitting down and telling a person, okay, you're depressed, all you need to do is this, or you're worried, what you need to do is that. There are some directive type of interventions, meaning that those approaches are very prescriptive, but as mental health professionals, we're not really in the role of dictating how people should live their lives. People who are really passionate about mental health are trying to help people get to a better space. There are some things like trauma and grief that people deal with their whole life. And the question isn't whether they get fixed or not. The question is, can we help them have a better quality of life? Can we help them reduce the symptoms? Can we help them move towards wellness? I'm a big proponent of mental health wellness. We don't talk about that enough as professionals, I feel. But the concept of mental health wellness means that I, as a provider, not only see where you are today with your mental health symptoms, but I'm also thinking about how we can move you to closer to a state of wellness so that you have the quality of life that you would like to have for yourself. And that is really the passion behind mental health for many, many people. And I caution you that if you're going into mental health, be prepared to walk with your clients on their journey. When you deal with things like addictions and behavioral problems like gambling and things of that nature, it's not easy to walk with a person through that journey. And as mental health professionals, we can't guarantee the outcome. We do the best work that we can. We give our clients the best service that we can, but we really can never guarantee that it's all going to be okay. What we can do, though, is we can be committed to improving the experiences of the people that we work with. We can be committed to making sure that as a mental health service provider, that I'm pushing you towards the concept of wellness. Yes, you might have a diagnosis. Yes, you may have symptoms, but that doesn't mean it will always be the case. So if you're going into this work, that's something really important to know, that, it's not really about telling people what to do, but it's really about accompanying people on their journey. Find the population you want to work with, find the people you want to work with. And even if you're a seasoned mental health professional, you're not stuck in one space or another. There is so much need. You can literally reinvent yourself several times over, reinvent yourself several times over during the span of a career. And sometimes we start out working with one thing. That's what we stick with. That's what we know. We kind of get pigeonholed. So if you're a current mental health professional out there and you don't find your job satisfying, or you've kind of lost the spark for what you do, maybe it's time to switch up, do something a little different, try something new, go a little further. One question that I hear a lot that people have concerns about as far as working in mental health is, opportunities to earn. Can I earn enough money to really financially make it, because for many, many years, mental health professions outside of psychiatry and psychology didn't always pay very well. I think that has changed with the move towards accredited programs, nursing accredited programs, psychology accredited programs, social work accredited programs, counselors accredited programs, art therapy, music therapy accredited programs. So now that we have these accredited programs, these master's degrees that used to be maybe 36 hours are now 60 hours, to ensure that people coming out of the programs have the education and the skill set that they need to be really good providers. With that being said, I think we've seen, because of the need, salaries are going up, opportunities are going up, and it's a lot better than it was many years ago. So, can you make a decent living in any of those professions? Yes. You can make a decent living working in mental health in any of the professions that I named. But you have to have a plan. You have to kind of know what you want to do. You have to understand that many people go into private practice and do well. Many people work for organizations and do well. It's just a matter of what you prefer. So I hope this segment on mental health careers has been enlightening and encouraging for you. If you're considering mental health, do your homework, look at some programs, get going, because you are needed. If you're a seasoned professional that's struggling, um, make a pivot, do something different, something fresh, something new. Thank you so much for tuning in to the Convos with Anita Santiago podcast. We are in Mental Health Month, Mental Health Awareness Month. So thank you for allowing me to bring this topic up of mental health careers. Please like, follow, share, subscribe to the podcast on all the major platforms. And again, you can always email me at convoscws@gmail.com. Happy listening.